You have to lead people to a higher purpose. I think you understand that here at Marquette. And in our case, for decades, our business model for a health insurance company had been largely about administering claims and managing risk. And while these are still very important functions for our company at Anthem Blue Cross Blue Shield and all across WellPoint, we have a higher purpose. Last year, we paid $100 billion in medical claims for our members, and we administered another $97 billion in benefits from the Medicare Trust Fund for Medicare beneficiaries. We're also the largest health benefits company in terms of membership, serving almost 1 in 9 Americans. But what motivates our people is not the number of claims we process or our size. It is the idea that our work touches and improves the lives of our customers, our members, of people, of your grandmother, your son, your sister, your brother-in-law, and even you. And how do we do that? How do we view our work? What drives us every day? We play a role that is desperately needed in this country, a role that we think we are uniquely positioned to play. We provide health, care, value for our customers. We work every day at every level to make sure our customers are getting the highest quality care at the most affordable price. We have more than 3,000 nurses and doctors, and they know that our #1 corporate value is customer first. Our doctors work with other doctors to make sure we're providing the benefits that are consistent with the current state of medical science, and that the doctors are delivering patient care that is focused on evidence-based medicine using the latest information. Our nurses work with children with asthma, for example, to make sure they're getting the tests and the medications that they need to manage their condition. We also have wellness teams that work with employers and businesses to make sure their employees are living healthier lives and in the process can reduce their health care costs. We even work with Zagat's, the restaurant rating company, to make sure our members can get access to an online tool where they can evaluate and select their doctors based on key criteria. Now, you wouldn't typically expect that of a health insurance company, but we're doing them, and we're going to do more because we're making sure that there is value in the health care that you receive. That is our job. That's the way we are leading our industry. And why do I believe that? Because when you talk to our nurses and our doctors or our wellness team, they get it. They know, and they are motivated by a higher purpose. They know that they make a difference in our customers' lives. And you can see the difference that that makes in how they contribute to our business and in the pride that they feel in being part of our company. I've worked for WellPoint for more than a decade, and during that time I've held a number of different positions. As Father said, I was general counsel at the health plan in Missouri, and then I became the president of Missouri, and then I became the general counsel for WellPoint, and then the president and CEO of WellPoint in 2007. And it was on the heels of many mergers that created the company that is WellPoint. We are 14 Blue Cross Blue Shield plans across the country called Anthem Blue Cross Blue Shield here, Empire Blue Cross Blue Shield in New York. And it created the nation's largest health insurance company. But it was also on the eve of this historic health reform debate. So my current job is about driving the change that's necessary to create an efficient and effective company that is creating value in healthcare for all Americans. And it's my job to be an advocate for responsible, sustainable healthcare reform. I am here as an advocate for healthcare reform. It's my job to stand up and say, we will do the right thing, and then I've got to do it. We at WellPoint, together with our industry, came forward almost a year ago now And we declared that we will be specifically advocating for healthcare reform, and we offered something that was not expected from our company or from our industry. We agreed that as part of reform, we would eliminate the barrier of pre-existing conditions and guarantee to issue policies to all comers in the individual market. But we knew it would only work if we could have the personal responsibility requirement to have coverage, much like you have in the auto insurance business where you have an obligation to have collision insurance. Now, there are many, many, many more issues being discussed in the current bills today in Congress. But it was an important change for our company, and it was an important change for our industry. It was, and it is, the right thing to do. So if you're going to ask your people to be change agents, you have to be a change agent. You have to stand up and say, I know I can do better, and I'm going to change. And then you have to do it. As a leader, you have to be substantive. You have to know your stuff. You have to work hard. You do have to show courage. But that is just the price of entry for leadership. To move an organization forward, to get it from where it is to where it needs to be, you have to live the change you want to see in your organization. And you have to do it openly. You have to be visible, and you have to do it enthusiastically.